Hi, so today I'm here to talk about the group session that I would conduct for the 3 patients that we were given. The activity that I would choose I would have them participate in an activity where they take turns answering yes and no questions on if they eat certain foods that are presented to them. And I would give a visual and state it verbally just to help with some of their understanding. And also, I would then encourage them to use a carrier phrase such as, yes, I eat apples, or no, I don't like apples, to help expand on their functional communication. So they're just not doing just yes and no. And that, based off the information that was given, I saw that some of them had more trouble with getting verbal communication out than others. So I would have to, kind of gauge and see before I went into the session based off the whole plan of care and not just with the little brief that was given. But if they were able to, then I would push to get a carrier phrase completed instead of just the yes and no questions. And then after we discovered the foods that each person enjoys and eats, then we would describe some of the foods that each of them enjoys. And I would choose this activity because it starts pretty simple with just answering yes and no using that carrier phrase. And then we are building and scaffolding on their word finding skills and conversational skills by describing various foods. I think the foods would be a good topic to choose just because it's very broad and common and simple item that everyone knows and can relate to. So then the next one is, how will you conduct the activity? So I would have a visual cue where I would have pictures of the foods, and the members would have to answer if they eat them or not. And when they answer the question in relation to the photo and the food that's stated, I would prefer for them to use the carrier phrase, yes, I eat, or no, I don't eat, depending on their function, what they're capable of doing. The next aspect of the task would be to describe some of the food choices, and I would use semantic feature analysis to do this because that's a great way to help with their word retrievals, building on getting those word retrieval skills out. So I would put a picture in the middle of a bubble chart kind of thing on a board that I would have, or even you can use, a piece of paper or whatever's available to you at the time. I mean, I would always prepare, but you never know in therapy. So I would put a picture and name of the item, and we'd go around and ask various questions on describing the foods. So I would give them some questions that could be asked if they're having some trouble. And things would be like, when do you eat it? What color is the food? What does it look like? What flavor is it? Just to have them expand on getting more functional communication and being able to describe items and also participate in conversation. So I would provide the feature list for support in order to help them. And then at the end, we could discuss some of the strategies that they are currently using when they are dining out to name foods that they want to eat or, take part in conversations. So then the third question was how the activity will address each client's goal. So the first patient, DM, he has the goal of participating in conversational tasks using word retrieval tasks. And this goal would be addressed in the first part where the patients would answer if they ate a food using a carrier phrase, but even more specifically, it would be addressed when with the use of semantic feature analysis when we're using that to describe the foods each person enjoys, giving different features. The next one was the patient HC, and he had the goal of making relevant comments during conversations in a group setting. And this goal would be addressed pretty much throughout because he would have to make comments that are pertaining to foods the whole time. And so this goal would be addressed when he's answering if he eats foods that are presented or if he doesn't eat foods that are presented. Also, he would have to stay on task to complete this activity as well. During the describing aspects of the activity, he would need to stay on task and make relevant comments to describe the food presented. So that's how we would address his goals, just making sure that he's staying on the topic of food and not, making comments that don't really pertain to the topic of food. And then the final patient was the patient KL, and he had the goal of maintaining the topic of conversation in group therapy. So as well, this goal would be met pretty much throughout. So this goal would be addressed because while we were asking if he likes certain foods and describing foods presented, he would have to maintain and stay on topic in order to target and work towards his goal of maintaining the topic of conversation. So if he strayed and started talking about something else, then we would have to just bring him back, and we would have to keep in mind their goals and how we're assessing them if they're reaching that goal or moving towards that goal. So how I would collect data during my session, I would collect data by seeing how each person achieves the goal of the activity. I would mark if they needed to be redirected or if I needed to give any cues or prompts for completion, since those are in their goals. Also, I'd write notes on areas I saw more struggles in, like more deficits, or where they succeeded, to know where to take my next session. I would be able to get a better understanding for the capabilities and areas of struggle, and this way I can have and make the correct adjustments for the next session in order to have more success. So if I saw that they were struggling and they were having a really hard time, then I would just bring it down a notch. Or maybe I can even give a visual to one patient because they're having more trouble, or a verbal, some kind of verbal or auditory cues to help the other patient, but just to make sure that we are keeping track of the goals that are listed. All right, so that's what I would do for that session. So we would use word finding, and they would have to recall if they ate certain foods or not, using yes and no. And we would introduce using the carrier phrases, and then semantic feature analysis to work on describing. And then at the end we can they could go around and have a little bit more of a conversation about it, but I would be the one leading the conversation and then seeing how it goes throughout. And that's what I would do. All right, well, I hope you could give me some feedback, and I hope you have a great night. Thank you.